Today I'm going to Saddleback Memorial Medical Center to see how medical professionals view responsibility and accountability during their treatment of patients. The hospital treats hundreds of patients each day. The nurses play an important role in the process and are responsible for handling a lot of critical information. We are here now, and I'm going to be meeting with one of the registered nurses and a nursing manager. So Oliver, what is the importance of accountability and responsibility in the healthcare profession?
To understand responsibility and accountability in healthcare, we need to understand the definitions of those terms. Responsibility actually refers to your scope of duties or obligations. So a hospital may give you a job description and some standard work and procedures that you would have to follow. Whereas accountability is taking ownership of your actions and the performance and the outcomes of those duties. So if I were to take care of a group of patients, I would be accountable to the organization to provide the best and safe care to those individuals. Dealing with the patient, responsibilities include assessing them, but also communicating the plan of care to them. They need to know the reasons why they're here in the hospital and need to understand what are the prescribed treatments that their physicians are giving them. So in essence, nurses have to communicate that plan of care to them and also make sure that the treatments are provided in a safe manner. And that way they can monitor the patient's improvement to those treatments.
So Oliver, can you give me some examples of being accountable when dealing with the patient's records, and why is that important?
Yeah, keeping records is important because, number one, we don't even know anything about these patients when they come in through our doors. So we have to establish a baseline assessment. We need to know the reasons why they're here. And once we understand why they're here, we write it in their record so it tells the patient's story accurately. So if we are providing any treatments or interventions to help them improve or recover from their condition, it will tell the story. Now, there are instances where something may occur during their hospitalization where we would have to follow the sequence of events. And so that's why keeping an accurate medical record is important in our profession. When I think about medical errors, the first thing that comes to mind is administering medications. We actually have to verify that the patient is truly receiving that medication. We have to verify the dose and make sure that the physician actually prescribed that. We also have to check their allergies. The reason why that's important is because if they have a bad outcome from taking that medication and they're allergic to it, the consequence of that is that they would actually go into maybe an allergic reaction or anaphylaxis, which would require ICU level of care or intensive care.
What are some of the factors that impact the profitability of the organization?
Well, the major factors that affect the profitability of our organization would be the quality of our services. And what I mean by quality, an example would be infection prevention. We have to do everything within our ability to prevent a surgical site infection or infection of an intravenous catheter. Otherwise, if we create that infection, we would be liable for the cost for treating that infection. In other words, an insurance company will not cover that cost for a prolonged length of stay in the hospital.
So Jessica, what is the importance of accountability and responsibility in the healthcare profession?
Work in labor and delivery. So for me, I'm not only responsible for the needs of not only just the patient themselves who's laboring and the mom, but as well as the baby who, starts on the inside, which I'm still responsible for them as a patient on the inside as well as when they come out. But also the family and all the family members that are there, being attentive to their needs, trying to take care of everyone in the room all at once, opposed to just the one patient. For us, especially on our unit, we're very teamwork based, so just because you have your own patients, but sometimes they're not as critical as other people's patients, and so then we all work together and you all go to a room that needs more immediate assistance. So really we're responsible for being a good team player and really helping out everybody else on the unit as well as your own.
So what would you say makes an accountability superstar?
An accountability superstar is someone who follows through on the promises, and they also take ownership of their mistakes. They report their mistakes, and they actually learn from the mistakes so they're not repeated.